all aspects. Barrier method, so this one, male condom, female condom, diaphragm, cervical cap, spermicide. So this one preventing the sperm union, sperm and egg union, okay, union. Sometimes the married couple, the wife takes the birth control. Still, in terms of contraception in barrier methods, both of the couples use some of these barrier methods also. So in order to prevent pregnancy, okay. Tapi you faham barrier methods ni, we are manipulating the anatomy of the male and the of the male and the female reproductive system. Okay. So after this slide is all about this barrier methods. Ni contoh dia, male condom and female condom. Boleh baca sendiri. Okay. But we manipulate the anatomical of female and male method. Ini patches patutnya ni dalam tadi hormonal patch. Contraceptive patch, transdermal patch. So this is under the other category, okay. This one diaphragm insertion, so looks like this. So these devices are being put to block or to give a barrier from vagina that at the cervix so that the sperm will not pass this barrier into this uterus, okay, uterine. Okay, this one, this is example spermicide. So despite of being, in addition to using this diaphragm, so apply this jelly. This jelly is spermicide. So you faham spermicide is something or substances that kill the sperm lah, or make it kata kill lah ataupun abnormal lah. We make the sperm abnormal, and so that therefore it will not fertilize the egg, okay. Next, cervical cap. So diaphragm is much bigger, cervical is smaller. Cervical cap, it put barrier at the cervix. So diaphragm, I guess it put barriers. Cervical opening is much more. So until the fold of this cervix, okay. Okay, next. Okay, sponge form sponge. Ni semua barrier method lah. Spermicide, this is an example of spermicide. Zinol 9 non-toxic detergent destroyed the sperm membrane. Okay. Okay. So sperm membrane. Sperm is a cell, right? So ada membrane. So kalau kita kacau environment dia ataupun environment the sperm by having substances that can penetrate inside the membrane of the sperm, it also can destroy it. Okay. Okay, this is IUD. So this is an example of IUD. The name, the brand, the name. Okay, Paragat. So Paragat uses copper. So in this Paragat, we have the copper IUD. So no dose meaning no. This IUD do not consist of any hormonal with it. Okay. So this one approved for 10 to 12 years. This copper and also the structure of this IUD, it will prevent the thickening of the uterine wall. Okay, dia macam ni kan. So dia letak T macam ni. Okay. So it will prevent the thickening and the thinning, or even the transportation of the sperm and the egg. Okay, so eventually even it will block, give a obstacle or really put obstacle for implantation step. Okay, prevent implantation. So this one, the name Mirena, have this lovonogastral hormone. So one of your one of your friend, Lovora. So Lovora, okay, Ira, Shaira share ni Lovora. So ni under the same syarikat lah ni, under the same. So this one have I think progesterone, okay. Oh ada tu saya tak baca ayat-ayat ni, saya baca ni terus. Okay ni ada copper and plastic. So ada progesterone, again you faham progesterone ni effect dia macam mana. So approved for 10 to 12, 5 to 7 years, 3 to 5 years. So this is the variance form of IUD and the temporal, the duration of wearing it. Yeah, so siapa yang nak more much longer atau memang tak nak anak, so dia pakai yang Paraguard. Siapa yang plan for 3 years just to finish up study maybe, okay, so 3 years etc lah, okay. Alright, next. Yeah, kecil je sebab kita punya uterus pun is not kecil lah, okay. Macam ni alright. Fertility awareness method, calendar tadi, okay. So we understand the reproduction way, knowledge, cervical mucus method, so symptothermal method, okay. So we manipulate the knowledge of reproduction in order to plan whether to have babies or not to have babies, okay. Okay, ni tak apa, cervical mucus ni rasa dah tengok, okay. Thin structure, watery cervic mucus, it's near to ovulation, and this cervic mucus, this type of cervic mucus also support the sperm transportation. Okay, emergency contraception tadi pernah cakap ya. Alright. Okay, mungkin you pun dah go through the slide. Ada tak slide mana-mana yang mungkin you nak explanation? Ni semua dah explain lah. So this one sterilization is more permanent way. So tubal ligation, cut and seal the fallopian tube. Hysterectomy is removal of the uterus. So ni pun ada variant dia, whether partially or totally remove the uterus. Vasectomy, vas deferens are cut and seal. Okay, so this one sterilization, tubal ligation. So looks like this. The ovary is still present. Okay, the fallopian tube is still present. Uterus is still present. So the ovarian cycle still occurring, follicle development still occurring, ovulation can occur, and that ovulation, that ovulated egg can be inside this, the fallopian tube, but the fertilization will not occur because the sperm will not be transported to this part, okay, the fertilization site. Okay, so ni kita manipulate the anatomy of the female, okay. Hysterectomy, we have variant partial, total, and radical. Partial, we just remove this muscular part over here. The rest is still present. Okay, so really no chance of getting pregnant at all. Like really remove the pregnancy chance. Okay. Partially like this. Total, start with the cervix until the rest of it. Yang ni cervix dengan vagina ada, yang ni kita I mean the procedure remove the cervix also. Radical, totally remove the whole system. Okay. Vasectomy procedure, so the vas deferens, remember the tubing, right? So it will, when it be ligated, okay, small incision, and then clamped, so ligate. Therefore, the sperm produced in the scrotum, in the scrotum, the seminiferous tubule will pass to epididymis, but it will not transfer or transported to the ejaculation pathway. Okay, so this is effectiveness in terms of birth control. So vasectomy, tengok bila permanent is really high effectiveness lah. Okay, and ni apa chance, in terms of chance. This one maksudnya by chance sajalah. So effectiveness is 10%. Okay. Rhythm method, spermicide. Okay. So abortion, termination of established pregnancy, miscarriage, induced abortion. Ini kita dah cakap tadi. Emergency pill also this one. Okay. Drug induced, this one mifex, block progesterone action on endometrium. Okay, anti lah, anti Just sama ada progesteron, mungkin ada banyak jenis lah. Okay, so kalau it's early phase, prior ovulation, the progesterone, taking the progesterone, it will prevent the ovulation. If it's already at ovulating ovulation time, okay, hari ke-14, this mifex have anti-progestin. Siapa yang bagi tadi, ada kan, ada satu anti-progestin, so it will block progesterone action on endometrium. So after day 14, progesterone high kan, so kita dah tahu dia, our endometrium is proliferate, maksudnya dia dah thicken. At this phase, the 14 days until 28, this endometrium is the thickening is maintained, and then this one is a secretory phase, right? Secretory, where the blood vessel induced to be proliferate. Okay, so progesterone stimulate this secretory phase, okay, or stimulate the blood vessel networking, ataupun the blood vessel bangsa endometrium tu untuk lebih menjadi bleedy lah, okay, because it want to support the implantation. Okay, so kata kita remove endometrium ataupun kita letak antagonist of progesterone, endometrium lah, progesterone, so the effect of secretory ataupun effect of maintaining the thickening endometrium will suddenly remove, right? So the endometrium will start to slot off lah, ataupun akan ada contraction. Contraction, okay. So dia akan start. Masa kalau normally bila 14 days ada ovulation, ada progesterone, pada condition dekat sini endometrium dalam keadaan relax. The contraction tak ada, very mild. Because it want to the condition wants to support ataupun encourage implantation. Okay, bila ada progesterone tu. So bila kita induce abortion, taking these pills over here have anti-progesterone or blocks progesterone action, it will cause contraction of the endometrium. Therefore, implantation is hard to occur lah. Okay. This one surgical method also induce abortion or force abortion. Ini boleh, inilah bahasa sendiri. So ada certain cases need this surgical method. So that medical situation you can have read on medical paper lah. Surgical methodnya. Okay, ni induce misoprostol, induce myometrial contraction, mifex, block progesterone action. So tadi saya dah cakap kan, sebenarnya bila ada progesterone dia relax. So bila makan, contohnya ambil this misoprostol, dia akan increase the myometrial contraction. Therefore, implantation is really difficult to occur lah, sebabnya endometrium tu keep contract. So kalau ada fertilized egg pun dia susah. Dia akan, contraction tu akan push the fertilized egg downward. It cannot attach and then penetrate the endometrium wall for implantation. Okay, ni vacuum aspiration. Okay, so yang ni semua boleh baca lah. Okay, so I think I stop here. Any questions so far on birth control method? I hope by now the learning outcome, identify contraception or birth control method to be applied at certain cases. then understand the underlying concept of hormonal regulation or anatomical approach that being manipulated by the birth control approach here. Okay, describe the application effectiveness of contraception and birth control methods. Amira tanya apa?
Mi, saya ada satu soalan yang
Silakan.
pasal birth control pills ni. Kan some akan suppresskan ovulation kan, prevent
Yep.
ovulation.
Yep.
Saya ada baca kalau tak ada no ovulation, the follicle kan tak dapat develop mature kan. So it
Betul.
will become smaller and jadi cyst dekat
Betul.
ovary. So disebab does that mean that every time tak ada ovulation, formation of cyst tu akan ada? Maksudnya akan ada.
Okay. Ini kena as long as the person taking the pills, ni kita go back to this female. Okay. Betul, bila ada cyst and then bila ada follicles dah grow tapi tak cukup, it's not enough to ovulate. Okay, therefore this follicle that grow halfway eventually will undergo like apoptosis ataupun dia akan degenerate. But the degeneration of this follicle cells here, dia become scar lah ataupun cyst. Okay, this smaller, nak kata apa, smaller tissue that degenerate from the follicle growth. So this is cyst. Okay. So this cyst here eventually kalau dia banyak sangat dekat the whole ovarian ni, so it will cause infertility problem. But again, let's say this is a normal healthy woman, so having normal cycles, so she has normal follicular growth. Okay, now she and her partner try to control the pregnancy first. Okay, so she take the pills that contain progesterone. Okay, so this progesterone maybe at the first time or at the first month of taking this progesterone or birth control pills, follicular ada growth. Follicular ada yang grow tapi dia halfway lah sebab dia dah makan kan progesterone ni. So dia akan negative feedback FSH, LH, so no ovulation. And the follicular growth here eventually will degenerate, might be just degenerate, betul-betul degenerate lah ataupun dia memang satu tisu kecil sebab dia belum besar menjadi like a scar over there lah. Okay. And then she take this progesterone, the pills here for like 6 months or almost a year. So you can imagine at first month, this follicular that grow halfway maybe will develop into cyst. But and then the second month, third and until 1 year, she keep taking this progesterone, right? So the high progesterone is at all time high level. GnRH ni memang akan tak ada, FSH, LH akan tak ada. So this FSH will not, when this is not present, no follicle will grow. The next month tu, follicle tu tak cukup signal untuk grow. Kalau dia grow pun macam sangat sikit lah ataupun kecil yang mana yes, it's a high risk that it will develop into cyst. But in terms of this surface knowledge, the follicular growth really cakap apa, put in halt. Okay. So cyst tu kalau follicle just grow like a tiny follicles grow, eventually cyst tu pun tak besar sangat lah kot. So betul lah ada high risk of cyst. Again, what I try to explain is this progesterone is always high in her body, therefore the NRH is very minimal and FSH and LH also very minimal. So follicular growth the next month will not be developing lah. Faham tak? Siapa tanya ni? Amira kot.
Faham Miss.
Okay, so in terms of high risk of cyst ni saya rasa kita semua kena baca lagi lah. Prevalence of prevalence. Kalau nak baca is you cari word prevalence cyst fibroid apa? Ovarian cyst. Ovarian cyst. Ovarian cyst in birth control women. Birth control women lah. Macam tu lah. So mungkin dah ada jugalah medical doctor ataupun the kesihatan awam yang kaji ni kan. So berapa statistik kalau kita ni ambil modern days ni dah ramai ambil ada kesedaran in terms of delaying pregnancy from one child to another child. Okay. In terms of delaying getting married and then delaying the pregnancy itu cerita lain kan. Itu pun ada konsekuensinya juga. Okay. So I think kesihatan awak or the general apa term dia bukan doktor lah, maksudnya dia memang kaji di statistik of overall inilah birth control and to prevalence of women cyst. Even kesihatan awam ni ada yang mungkin kaji instant food and fertility problem. Okay, so cuba carilah, kalau jumpa tolong share dalam website group so that saya baca, awak baca. Okay, so increase our knowledge lah. Alright, thank you Amira for the questions. I hope this discussion creates facilitate more bigger questions that you want to, that enhance you baca lah. Okay. Baca dan cuba faham lah. Okay. Ada soalan lain? So insyaAllah Jumaat ni ada case study. Cuma minta semua ada seorang kawan you guys sedang hadapi ujian nenek sakit lah, ke meninggal So minta doakan untuk Fatin but I'm not sure which Fatin, sebab Fatin ada ramai kan. So cuma yang ni saya nak tanya you guys, kalau kita delay hari Sabtu ataupun untuk case study lah. So soalan case study lebih kurang yang ni ya. Saya harap saya dah cuba tunjukkan apakah contoh case study lah lebih kurang ni soalan sexual assault ni, ataupun soalan ni injected hormone X is progesterone dalam gestation fetus. Okay, nah ni